Assalamualaikum dan selamat tengah hari buat semua. Semua boleh dengar ke?
Boleh dengar.
Okay, thank you Dr. Aina. Terima kasih buat semua yang telah hadir kepada sesi CME Bulanan Unit Kualiti Peringkat Hospital Sultan Aminah Johor Bahru. Jadi CME kita pada hari ini bertajuk Reducing Stigma and Discrimination Among Healthcare Workers Toward People Living with HIV yang akan disampaikan oleh Dr. Indrani, anak perempuan Marathon daripada Unit Kualiti. Jadi tanpa membuang masa, saya menjemput Dr. Indrani untuk menyampaikan CME beliau.
Okay, good afternoon, salam sejahtera to all present today with me. Thank you so much for being with me this afternoon. This CME is actually just to create a small awareness among us, healthcare workers, about reducing stigma and discrimination, SND, among healthcare workers towards people living with HIV. People living with HIV will be known as PLHIV. Yeah? Okay, the content today will be to define and discuss stigma and discrimination briefly, and to consider specific factors that should be addressed in healthcare worker education, maybe in CMEs, and also to share with you all about the survey done in our hospital, Hospital Sultan Aminah Johor Bahru, on reducing stigma and discrimination among healthcare workers towards people living with HIV. So, definition of stigma, just a brief one, a set of negative and often unfair beliefs that a society or group of people have about something. This stigmatization reflects an attitude. In Malay, just a simple translation, stigma ialah perasaan tidak puas atau suka terhadap individu tertentu berdasarkan ciri-ciri yang mendapat tanggapan buruk masyarakat. Ia boleh datang melalui pelbagai faktor sama ada ia berkaitan dengan budaya, obesiti, jantina, bangsa maupun penyakit. Last time even kalau ada budak gemuk pun macam stigma kan. But now most of us already obese. And definition of discrimination. Discrimination is the unfair or prejudicial treatment of people and groups based on characteristics such as race, gender, age, or sexual orientation. Discrimination is an act or behavior. Kalau tadi stigma is an attitude. Discrimination is behavior, how you treat these people. Diskriminasi merujuk kepada pelayanan yang tidak adil terhadap individu tertentu, di mana layanan ini dibuat berdasarkan kumpulan yang diwakili oleh individu berkenaan. Usually those who are being stigmatized and discriminated usually will be like IBDUs or sexual workers, those groups. Okay, types of stigma. There are actually many types of stigma, but we will just see a few. External stigma is the experience of individual treated differently to other people. Like person A is treated differently from person B. Person A is given all the benefits, but person B is sidelined. Internal stigma, the way a person feel about themselves. They themselves feel down, they feel low esteem, they themselves feel rejected, they feel ashamed. And familial stigma, the prejudice and discrimination experienced by individuals through associations with their relatives. Like for example, if in a family, there's a HIV patient in the family, the whole family will be stigmatized. Nobody want to be friends with them, nobody want to visit them. And even if, let's say like someone from the family has gone to the prison for some crime, same thing, you know, they'll be stigmatized. So this is the discrimination experienced by individuals through associations with their relatives. Social stigma is the disapproval of or discrimination against an individual or group based on perceived characteristics that serve to distinguish them from other members of a society. This will go again the same thing like IVDUs, the gangsters, the sexual workers. They are the groups already, they will be stigmatized. These people are like this. They are doing it purposely. They can do others, but they still go for this kind of work. Like that. So the examples of external stigma is avoidance. We usually try to avoid. The moment you know the person got HIV, you will try to avoid them. You don't want to go near them. You don't want to join the activities where there are people with HIVs. we try to be as far as possible from people with HIV or AIDS. And isolation, these people will be isolated. At home, they're given a separate room, they're given the separate pinggan mangkok, glasses, and at place, sometimes they're even not allowed to use the front door. They have to use the pintu belakang. Going in and out, they have to go through the pintu belakang, whereas the rest of the family will go through the front door. And in community also, you will see, like even in the bus, if you know that the person has some, you know the person is HIV or something, you will try, you won't sit in the same seat. Even if the bus is crowded and there's an empty space beside the person, you will not sit beside them. And even in maybe in time, place where we go for prayers, especially like churches where you have benches. So if the person is, and it will be a small community where you know who is having what. So if the person is sitting in that bench, nobody else in that community will sit in the same bench during the prayers. And rejections. These people, when they apply to go for maybe a certain units or certain services, courses, they will be rejected because of their HIV status. And moral judgment. The moment you know the person is HIV, you automatically will think they must have got this sickness due to some immoral behavior. Actually, HIV can be transmitted through many types, right? Even blood transfusion, needle stick injury in our cases. But say we got HIV because of needle stick injury or what, but our neighbors, how many of you all think that they will actually think you got it because indirectly? They might still, in inverted commas, they'll have their question mark. They will think you did something where you got the sickness from. And ultimately, these people will be victimized and might go through abuse. Examples of internal stigma: the person will go through shame. They will feel like, I feel guilty that I'm HIV positive, and fear of rejection. They fear being rejected by their partners, their families, so they avoid going for the test. They fear that they will be test positive and they will be rejected by their close ones. And they will exclude themselves from services opportunities. They know if they have to go for that particular course, they will have to go through this test. And then once the test is done, they will know that the person, he is HIV positive, and then he will be stigmatized. So he will exclude himself from that service and he will lose the opportunities. And low self-esteem, they really feel low, like they sometimes feel worthless because they are HIV positive. And social withdrawal, they will not go for any functions, gatherings. They themselves will withdraw themselves, isolate themselves because of that low esteem. And fear of disclosure, they, as far as possible, they will try to hide their status, especially from their partners and family. And just to say here that self-stigma is actually deadlier than the virus inside the body. Like this, many people who are suffering from AIDS, actually they are not killed by the disease, but by the stigma, which is actually deadlier than the virus itself. Forms of discriminations, that like I told just now, discrimination is behavior, that is name calling, finger pointing, labeling. We don't actually know how they got this HIV through what, but we'll start labeling them, blaming, judging, gossiping. We make assumptions, we suspect that they've gone through some immoral thing. We neglect them, reject, isolate, separate, not sharing utensils, hiding, and we stay at a distance. At this time, only PKP, without being called upon, they will all stay within the distance. Harassment all the way can go up to physical violence and sexual abuse. Stigma in health service. Why are we trying to avoid this stigma in health service? Because when healthcare workers start stigmatizing and discriminating patients, mainly in antenatal care, this will discourage access to antenatal services. The patient will not come forward the moment she's pregnant. She will not come forward for antenatal services, and this way she will be prevented from accessing to counseling. Only when you counsel the patient, she will know that she can go in for treatment, and she has to go for the HIV testing and the MTCT services. All these are available. If you look at them with stigma, then they will not come for all this. And then this will also discourage Disclosure of HIV results to the partners. You will be positive, but you won't tell the partners, and when you are with him, definitely you are going to spread it to the partner as well. And discourages acceptance of MTCT interventions. If you don't counsel, they're not going to understand what is MTCT and they will not accept it. And this will also inhibit use of safer infant feeding practices, and it confers secondary stigmatization on the child. The unborn child, the pure child will be already stigmatized even before the child is born. This is for mainly for ONG side. This one is because among us, the shuffling between providers to avoid caring for HIV patient. When we know there's HIV patient, we try to pass it over to our members. You go, I go, and like that. We don't want to, as much as possible, we don't want to be the one who's caring for that patient. And we deny health services for them. And provision of substandard treatment, we treat them differently. The patient with not HIV, we spend time with them, we really see them from top to toe, we really examine them and give them full treatment. But when you know the patient is HIV, we try to see them as fast as possible. If possible, we sit far, we don't want to touch them. Even their cards, we just say, okay, all okay, BP okay, temperature okay, sambung obat 6 bulan finish. Unlike the others, we will tend to touch them and really examine them. And patients with HIV will be placed in separate rooms and separate medical tools used for people with HIV and AIDS. So what could be the root cause of this? Why are these healthcare workers are having this problem, stigma and discrimination towards PLHIV? Mostly it is because of lack of knowledge and fear of HIV and AIDS. Even though we are healthcare workers, many of us are still don't really know much about HIV or AIDS. We don't really know how it's transmitted, fear of transmission, lack of specific in-depth information about HIV transmission, and fear based on public messaging. We are now into the internet world, WhatsApp, Instagram, everything, and we can get all kind of messages. Despite being in the medical field, we still tend to believe. I will just like to share one incident in Ethiopia, but it's not about healthcare workers, but it's just about the community there. Apparently there, they believe if a person with HIV, after using the condom, if he throws the condom into the padang, and there are grasses, and the cow comes to eat the grass, and the cow eats the grass and gives the milk, and if the child drinks the milk, the child gets HIV. So that's how they believe. Luckily, it's not a healthcare worker, it's just a common public that believes that. And the perception that HIV infection is a result of personal choice. Many think like that because in this world now, all this partying and free sex and all those things, they say if the person gets HIV, they'll tell, I already told you, you know that if you do all this, you're going to get, then why do you do it? But actually, it's not true. They don't know how to take precautions for that. It's nobody actually chooses to become HIV positive. So it's definitely not personal choice to become HIV positive. The stigma is also exacerbated by the seriousness of the illness, mysterious nature, and its association with behaviors that are either illegal or socially sensitive. For example, prostitution and drug use. So how can we address this among our healthcare workers? So we need to educate and train healthcare workers, healthcare providers in how the HIV is being transmitted. Can be done through CME or Bankales, activities to address stigma. We can have maybe a role play or something, and MTCT related policies. Even though you are not in SU ONG related units or departments, you should also know these MTCT related policies, and counseling and safer infant feeding practices, and awareness of language that describes PLHV. You know, sometimes they use certain words that actually points towards the PLHIV. So they are very sensitive towards this. So you must be aware, and you must be sensitive about the language you are using when the PLHIV is around you. And to ensure the policies and procedures are in place and implemented for, like non-discrimination policies, confidentiality, universal precautions, post-exposure prophylaxis. All these policies and procedures should be in your place where you are working and where you're treating the PLHIVs. Healthcare workers can act as role models for others in helping combat stigma. This is what we can do for our community. We have to show support and responsibility. Jangan Dr. Mas yang care about HIV patients, we also must support our patients. Care for all people regardless of their health or social status. Miskin ke kaya, we still have to support them and not to discriminate. Discrimination and isolation of people living with HIV/AIDS. Prevention strategies will become far more successful if HIV is treated as any other disease. You don't see HIV as something special. You put them in inverted commas, just treat it as any other disease. So people will come forward to ask for ideas or treatment or information regarding HIV. It's because we put the HIV in a different perspective. That is why people are still not willing to come out and seek treatment. Healthcare professionals can become advocates for acceptance and care. So we call upon you to look inward and first examine your own beliefs, values, assumptions, and attitudes towards HIV and AIDS. But now, why are we suddenly so much of hoo-ha about this stigma and discrimination? That is because now internationally, they are going towards reducing this stigma and discrimination. So by 2025, they are hoping to reduce by 80%. And by 2030, they're actually hoping to be zero HIV. And so this is Malaysia, ending AIDS in Malaysia. Is it a myth or will it become a reality? It's in your hands. We, healthcare workers, we have to go forward. We have to stop our stigma and our discrimination against these people. So we are the one who are going to go forward and bring out the public to come to us for the treatment. So what have we been doing? Our KKM has come up with a project pengurangan stigma dan diskriminasi terhadap orang yang hidup dengan HIV/AIDS di kalangan anggota kesihatan melalui pendekatan peningkatan kualiti. Few hospitals have been chosen in Malaysia, and in Johor, the Lucky Hospital Sultanah Aminah has been chosen together with KK Mahmudia. So in Hospital Sultanah Aminah, 3 departments, 3 lucky people were chosen, were the ONG, pharmacy, and medical. Medical contains all the departments that comes under medical, that is respiratory, dermatology, hematology, gastrology, neurology, nephrology, everything that comes under medical is also taken into this survey. So these are the questions that has been asked in that survey. How worried are you about getting HIV if you draw blood from PLHIV? Many of us, like I said just now, the moment the person is HIV, you try to pass the patient to your friend. So how worried are you about drawing blood from PLHIV? Do you avoid physical contact when providing care or services to a PLHIV? Do you try to put yourself as far as possible from the patient, or do you really go near them and talk to them? Do you wear double gloves when providing care or services to PLHIV? Have you observed healthcare worker unwilling to care for PLHIV or thought to be living with HIV? It's not the patient himself who's a HIV patient, but you know the patient takes care of another HIV person in his family. So the person is not willing to care for him. So have you observed any healthcare workers? Or have you observed any healthcare workers providing poorer quality of care to PLHIV or suspected to be living with PLHIV? So if these 2 things happen, if you observe somebody unwilling to care or providing poorer quality of care to PLHIV, kindly report to your supervisor, your sister, matron, doctors, anyone, not to scold them or anything, but so that we can counsel the health worker and make them understand that PLHIV also need to be taken care of as any other patient. Do you strongly agree or disagree that there are standardized procedures or protocols in your health facility that reduce your risk of becoming infected with HIV? Does your facility has written guidelines to protect PLHIV from discrimination? Do you strongly agree agree or disagree that women living with HIV should be allowed to get pregnant if they wish? So do you all agree or not? Does women living with HIV should be allowed to get pregnant if they wish? Kalau dulu-dulu memang we all try to advise them not to get married, not to get pregnant, but is this still the same? So these are the result of the 8 main domains just now that we and the questions just now. So the highest, as expected, was worried taking blood from PLHIV, which came up more than 80% of our medical, ONG, and pharmacies staffs were worried taking blood from PLHIV. And also avoid physical contact with PLHIV, also more than 80%, and wearing double gloves while attending PLHIV also third highest. Unwilling to care for PLHIV was 40% and above. Care provider providing poor quality to PLHIV was 48.6%. Women with PLHIV should not allow to get pregnant is 46.8%. And just to share with you all, among all the hospitals that had taken part in this survey on that day, Hospital Sultanah Aminah got the best result for this because everybody has had a higher percentage, so we had the lowest, which means our SCOG people really know that women can be allowed to get pregnant. So Tanya, SCOG HSA, congrats. And has standardized protocol or procedure on HIV is high, 96. Most of them are telling that it's the standardized protocol. Has written guidelines to protect PLHIV is more than 60%. This one is divided by into medical oriented pharmacy, so you can see who has the higher percentage. So very taking blood from PLHIV, of course, is affected pharmacy because they are not, they don't really go for treatment to PLHIV. So when they put themselves in the shoes, thinking that they have to take blood from PLHIV, is no doubt they are worried taking blood from PLHIV. The next highest was medical, and the least was ONG. And avoiding physical contact with PLHIV, again the highest was pharmacy, and followed by medical, and then ONG. Wearing double gloves, pharmacy was the least, of course, because they don't really treat them, so they don't really need to use gloves. And medical was 65.1% and ONG was 61.6%. Unwilling to care for PLHIV, did you see any of your
Claim, so sister bagi kat sini CP dia. So dia kena kerja lah.
Pharmacy was 54.9%, ONG 42.2%, and medical 40.9%. Providing poor quality care for PLHIV, the highest was again pharmacy, followed by medical and ONG. Women with PLHIV should not allow to get pregnant, like SCOG is of course the lowest, 36, ONG is lowest, 36%, while medical and pharmacy, 49.3%. Having standardized protocol procedure, all of them got 90 and above, and written guidelines to protect PLHIV, medical 63%, and ONG 78.7%, and pharmacy 40% only. Okay, this is just information for you all. So what does PLHIV expect from us, from the healthcare workers? Just to share with you all what they want you all to do. Was information about your health explained clearly? This is the question for the PLHIV. Yeah? So was information about your health explained clearly? When you see the patient, do you really explain to them about their health? Was the clinic welcoming and friendly? Are you all welcoming, or do you all tunjuk muka when they come? Were you treated with respect during your visit? Were privacy and confidentiality observed during your visit? Did you experience discrimination from a healthcare provider or other staff member? Were you involved with decision making about your care and treatment? Do you people really talk to them, discuss with them about the treatment? Did your provider spend enough time with you during your visit? Do you all spend enough time with them? More than the medication you give, the care and the talk, the way you talk to them is actually is a better healing factor than your medication. So this is their result. This is all just for you, just for you all to know about them. So only 4% agree. 0.4% said that they are actually informed about their health and explained. And only 0.4% said that clinics are welcoming and friendly. And only 0.4% said they are treated with respect. And only 3.9% said they had privacy and confidentiality. But this one, we can't say anything due to our infrastructure. We don't have enough rooms and so many patients. So this one, we are unable to help for the time being. Hopefully with the ACC coming up, we can do a better job. We will be able to provide more privacy and confidentiality to them. And experience discrimination from healthcare workers, only 12.1% said that. And not involved, whether they're involved in the decision making is 7% only. Doctors not spending time during their visit, 2%. And paramedic not spending time during their visit to 0.8%. This one also we can't really blame our healthcare workers because of due to the overcrowding and space confinement. Even if they want to, I think there's some difficulty there for them to be able to give enough time and spend time with the patients. Okay, so this is what we did for our healthcare workers. After the survey, we conducted CMEs, especially during the orientation week. And this is the online CMEs which was done by the JKN. I'm not sure whether you all remember or not. Early this year, every week there was a CME on HIV. And thank you to JKNJ for that. And this is a health promotion material. So the punting we will put up if there is any activities going on in our foyers. And the mural painting at the staircase, is in front of Counter Masri in Polyclinic. And the other mural down there, the colorful one, is in foyer 2. Okay, later we will just discuss a little bit about that. Just want you all to know what the figures mean. And this is our ID clinic, working hard with ILZ to provide support, shelter, social support, and referring patients to other agencies. And they are also doing home visit. Okay, this is after the interventions. So these are the results. The baseline is in the red. The first survey is in the light blue, and the second survey in green. So on the whole, we can see there is a downward trend. After the interventions, after the CMEs, there are some awareness among our healthcare workers. So the surveys have been showing downward trends, which is actually a good thing. It's a positive. So this is indicator 1. Worry taking blood from PLHIV has come down from 83% to 64%. Avoiding physical contact with PLHIV also has come down from 28% to 23%. Wearing double gloves when attending PLHIV also has come down from 60 to 53, although it's a bit slow, but it's coming down. And this one is observing healthcare worker unwilling to care for PLHIV and providing poor care. It's gone up from the previous survey. We think it is because of the new staffs. However, it is still less than when we first took the survey, the baseline survey. This one, no standardized protocols to reduce risk of healthcare workers becoming infected with HIV, and no written guidelines to protect PLHIV from discrimination is going up. I think this is also because of the new staffs in state, because actually we do have all this. So next time they're taking the surveys and they're asking about policies and guidelines, you all know actually we do have these policies and procedures on infection and prevention and control. Guidelines for nursing management of people infected with HIV, and guidelines of counseling of HIV infection and AIDS. So we do have all this. Maybe you can look up in your clinics whether if you have this. We don't have this, maybe we can try to get it for you all. And this is what I just wanted to tell you all. This mural painting in foyer 2. Many of you will see the painting, but maybe you don't know what it actually means. So you can see the man who's holding, covering his face with the hands. That's illustrating of an individual with their head in their hands and their mind is filled with dark thoughts. Another individual, the pink color, where you can see they are the clear-minded people. They are supposed to be us. and their mind filled with dark thoughts, another individual is seen reaching out their hand and showing this individual that there is nothing to worry about, and injecting their mind with the happy thoughts. The colorful thing that you see in the brain there, that is the happy thoughts that we are injecting them. And familiar stigma. You can see that somebody hugging the person there. Illustration of an older woman hugging her child in the silhouette of a HIV red ribbon. It symbolizes familial affection and support that is very important to individuals who face stigmatization. And up there is the communal stigma, illustration of an individual reaching out to lend someone else a hand, showing compassion and love within the community. The pink color hand and the dark color hand. And the one down, internal stigma, illustration of an individual trying to help someone else find light in the dark by showing them their inner demons. Their internalized stigma is only exists in the mind. Actually, it's nothing there. And the other two people holding the hands, of two individuals holding hands with band-aids on their arms, showcasing that they are HIV positive and are united as important members in the community. Even though they are HIV positive, they are also a part of our community, and they are also important to our community. And there's a red string actually running all along the painting actually. It symbolizes how interconnected everyone is and also pays tribute to the HIV red ribbon. So here we call upon to all of you regarding stigma and discrimination. You have to stop it. You have to try and do something about it. It has to stop with you. If not you, then who? Thank you.